Hi, I'm Dr. Melanie Palm from Art of Skin MD in San Diego, California, actually in Solana Beach, just outside of it. And today we're going to be talking about a non-surgical nose job. We can actually use fillers very artfully placed to completely reshape the nose. We've got several before and afters on our website, and it's one of my favorite things to do. I think it is important for patients interested in this procedure that you really go to someone who understands not only the architecture of the nose, but the idea that this is a little bit higher risk area. There's some really important vessels that travel around the space, and you want to make sure that you're doing this in conjunction with a surgeon that really understands this. So we have a patient here today that has always noticed a little bit of a bump on the side of her, or on the bridge of her nose, and we call it a dorsal hump, which isn't a very sexy name for things. But I want to show her actually in profile. And so you can see from her profile, this is that little ridge that we see, but we can put a teeny bit of filler just right above it, right below it. And then if we look at her head on, so if you don't mind doing that for me, you can actually see there's asymmetry from the right side to the left. So there's a little bit of a concavity right here that we want to correct. The other thing we can do to raise the nasal tip, so if we'll look at her profile again, I can put a little bit of filler sort of between what are her cartilage, they're called lower lateral cartilage in this area, to raise the tip up. And then my other tip is sometimes we'll put a little bit at the base of her columella, and this also helps with tip rotation over time. We don't want to take away the authenticity of her nose. She actually likes it, and I don't want her to feel like this isn't her nose. I use typically something sort of mid-strength. We're going to use Restylane L, which already has lidocaine pre-incorporated in with it. And then I have actually transferred that filler into these little BD syringes. They've got an incredibly tiny needle, and I don't have to use much pressure. It allows me to put very small amounts, which I think is important for this procedure for safety of the patient. So with that, we're going to get started. And we'll do most of this work, I think, from profile. So the patient's had some topical numbing on, and there's actually numbing in the filler itself, which makes it really a pretty comfortable procedure. So I'm just going to put some little aliquots, and I'm actually just doing that a little bit midline, teeny pinch, shouldn't be too bad. Teeny bit. So I'm putting like 2 or 3 hundredths of the actual syringe in this, just to help the bridge above that little bump in the nose. And you can see that already starting to take shape. And what's really cool, we'll try and share her before and afters, because I think you'll see a pretty nice change where she still recognizes her own nose, but we've really sort of helped it along. Good. All right, and then we're gonna do a little bit here. Teeny poke. Awesome job. Little poke here. How you doing? Okay?
Good.
And I'm right between those lower lateral cartilages. Teeny poke up here. And I like this technique when we use this small amount, because we can just do small tailoring bits and have a higher safety margin as we're doing this for our patients. Beautiful. Okay, I'm going to come over on her left side. Maybe what I'll have you do is just turn towards me a little bit, and actually I'll come over to this side so we can show that. And then look straight ahead for me. Teeny little poke. We're just going to correct that little bit of volume deficiency on one side versus the other. And then our final little bit, I'm going to put a little bit at the base. So teeny poke, and we've actually numbed her here, 1, 2, 3. And that helps support the base of the nose. Good. Just doing a little bit of fine tuning. And that is a really beautiful nose. She's going to get just teeny bruise right there, and there's a little bit of swelling, but you can see in profile that is a very pretty nose. We've disguised that dorsal hump and we've rotated the tip up. She has a much more feminine nose, but still one that she really recognizes and keeps the authenticity of this beautiful face. So if you have any questions about a non-surgical nose job or questions about using fillers in higher risk areas such as the nose, give us a call at Art of Skin MD. It's 858-792-7546, or you can look us up on the web. It's artofskinmd.com.